So, as I said, I'm expecting our colleagues, our panelists, to react to the theme of the conference from their perspectives, to react to the keynote speeches, to react to the declaration. We'll have a series of questions in which I'd like you to come in, so I'll be watching whoever wants to add, contribute, challenge, disagree, or agree on what's said, number one. And number two, later on, I have two sets of questions. Number two, we like to hear more this call for action. What can we do at the broader EU level? What we should be doing further at the broader EU level and at the broader European level. I'll be introducing, if that's okay, each one of you has asked you a question. I think it's easier for the timing. And I will start by the policymakers, actually happening, as it happens, sitting together on giving us a country perspective. I'd like to introduce Ms. Zetta Makris, Deputy Minister of Health of Greece, as our the first question, if you wish. I had the privilege the other day in Gastein to moderate Minister Georgiadis, your Minister of Health, and he was saying a bit the point that Martin Seiko was saying, is not a crisis, it's a new reality. And indeed, it's not a new reality that only happens to Greece. It's a new reality that happens to all the member states. And we want to learn more from Greece. Greece is undertaking a huge program of reforms to achieve the sustainability of the health system under crisis. We learn an awful lot from them, from their leadership, from their reform, their dynamism. And I'd like to ask you, Deputy Minister Makris, what kinds of priorities after this experience would you recommend to the others based on your experience? What are the key priorities, the first actions you had to put in place to get this sustainability without undermining the access to the health services and maintaining the very basic principle of value that Shoshana Yaka was talking about, universal health coverage?
Professor, actually, I don't think I want to recommend something. Just to
I'm not sure if the microphone is on. I think actually if you'll, yes, okay. You'll have to push it.
As I said, Professor, I don't want to recommend. I actually want to expand and explain what we are doing in my country. And indeed, the pressure on our health system has been very strong. Susanna Jakob mentioned before Greece as one of the countries that the health expenditure decreased. You are right, Susanna, between 2009 and 2011, in current prices, total health expenditure in my country decreased by 19%, and total public expenditure on health decreased by 23%. Pharmaceutical expenditure decreased by 45% between 2009 and 2012. These figures reflect that our inelastic priority was to make savings while enhancing efficiency, because we knew that there was scope for both of these. So we started with measures which would yield immediate results, but still we tried not to lose sight of principles on long-term efficiency. We had to proceed with cuts in pharmaceutical prices and take various difficult measures for pharmaceuticals. We adopted some procurement practices which save us money. We changed the hospital reimbursement system. We restructured the hospital sector with hospital mergers. For the social insurance funds, we merged the health funds by establishing one central organization. Still, we had to take some difficult measures like cutting salaries and introducing patient charges. The challenge for us is to identify correctly the population groups for whom these charges are not affordable, causing them a barrier to access, because we know that equity has been impaired. For some insured groups, the reform led to a widening of the choice of the healthcare provider, so their access improved. However, for the unemployed and uninsured population, access is impeded. So, equity and universality of access are our major concerns. That is why we believe that these two values should be at the core of our policy recommendations for sustainable health systems. Additionally, I would like to stress that we have invested in new technologies for data gathering and analysis. By better access to information and monitoring, we have been increasingly basing our decisions on evidence, which is also crucial. And concluding, I would like to say that our strategic decision has been to strengthen primary care as much as possible so that most of the population is covered. By creating networks of various providers with greater integration, we believe that we will be more responsive to patients' needs and at the same time more efficient. Also, we take complementary measures like the health voucher program for the vulnerable groups to access health care, social welfare benefits for vulnerable groups, and building alliances with the voluntary sector who is active in primary care provision, and we try to increase universality of access. I hope I was brief as you suggested.
Thank you very much. We'll have the opportunity to ask more questions to you. If there's any from the audience at this stage, we've got a very clear agenda here. You say you don't want to recommend, but may I say that many of the points and the strategies you put forward ought to be recommended. The way you did reforms on the procurement, on the payment systems, the way that you strengthen primary care as a fundamental element to access the health system and ensure universal coverage. Also, thank you for acknowledging all the difficulties and complexities in doing that. I suppose one of the issues has been as well the communication to the population to make all these changes. That must be one of the issues that we, Susanna Jakob very much highlighted, is the governance and the transparency of these processes, how you bring the population on board and to agree on what are very complex, very painful situations, and to the profession, of course, by having to cut salaries, as many other countries in the European region had to do.
Yes, you said that mildly, but that is the truth. But I have to admit that in my country we should make all those structural reforms before the economic crisis. Anyway, now we are trying hard, and the problem is, you know, that changes and laws are not imposed, they are implemented. So have to persuade doctors, patients, or those involved that that is in the right direction, that is of paramount importance to us to behave and react like that to that economic crisis.